we're taking this approach and we're saying, what happens? Can we take this approach and take it more global? And I say more global intentionally because at the Duke Global Health Institute, we think of local as global and global as local. And so the work that we do domestically is part of global health research. But now the question is, can we take this outside of the US? And we could do this in lots of places in the world. We've seen amazing increases in the penetration of internet technologies all over the world, but particularly in Asia and Africa. And so these are really ripe for the kind of work that we do. Mobile has changed everything globally as well. Anywhere you go in the world, you'll find a telephone connection, and a lot of companies, Facebook, Google, SpaceX, are all thinking about wiring, making wireless internet connections all over sub-Saharan Africa is one example. And there are more smartphones worldwide than there are toilets. So this gives us an unbelievable opportunity to kind of do digital health-oriented research. But we've decided to start in China. China is an important place to start with obesity research because they are experiencing an incredible increase in obesity. They have their own obesity epidemic happening right now. They're number 2 in obesity globally. 30% are affected. And what's different about China, and we can talk about this later if you have questions, is that in China, Chinese populations tend to experience diabetes at lower amounts of weight gain than we do here in the US. And so the problem here is you really do need to stop weight gain because when populations become diabetic, they slow down in productivity, it impacts the workforce, that impacts economic development, becomes a big issue for a country like China. There's a lot of interest in this kind of work there. And the answer for why this is happening is pretty obvious. Any of you who've traveled to China in the last 20 or so years can see it. If you went there 20 years ago, you saw people riding around in bikes and walking. And if you go there today, you'll see lots of people in cars and in buses and amidst lots of pollution and next to Papa John's and KFC and Starbucks and all of those kinds of places, the same kinds of places that we tend to frequent. And so what we did in this study was that we completed about a year ago now, was to simply ask this question: can we take what works here in the US using this IOTA system and export it to China? With some very simple tweaks to accommodate differences in diet and some differences in behavior, but otherwise do exactly the same thing as a first step. And so that's what we did. We did this with several hundred folks in China, in Beijing, just outside of Beijing, and what we found was larger weight losses than we experience here in the US, big improvements in lipids. I mean, just very large improvements in lipids, almost unbelievable to me. Certainly at a clinical level, and high rates of satisfaction. People enjoyed using it. And now we're rolling this approach out more widely. And we're doing this in China and beginning the process of exploring lots of parties who are interested all over the world in IOTA and these kinds of digital health approaches. This will be a major thrust of our new Center for Digital Health Science. And so I'll end as I started by talking about the year 2000. Back in the year 2000, I was tooling around in my basement with a computer that looked something like this. It was a bit of a honker, and I stubbed my toe on it several times. But if you ask me where things are going, I'll tell you I don't really know. I imagine we won't be wearing Google glasses, though. But right now, that's the hot new thing. You'll see a lot of people walking around here with these in the next year. But I do know that these kinds of approaches are useful, and that we can use them to close disparities in a wide range of health outcomes all over the world. And I hope that you'll join me in that effort. Thank you.